Hello, Assalamu alaikum, Mr. Hamid. I'm Dr. Sindhu, one of reading doctor today. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. Mm-hmm. I'm very sorry to hear about it, Mr. Hamid, and I understand that how difficult situation would be for you. But to better understand your condition, I need to ask you a few questions. Is it okay with you, Mr. Hamid? Thanks for your cooperation, Mr. Hamid. So, Mr. Hamid, how long did these episodes usually last? Mm-hmm. 10 to 15 minutes. And how do you feel afterwards? Mm-hmm. Nauseous? Mm-hmm. And do you have vomiting too along with that? Mm-hmm. Okay, Mr. Hamid, as you stated that yesterday you fell, did you lose consciousness? No? Okay, have you felt like there are any specific triggers to these episodes? Mm-hmm. Okay, do these episodes come up with stress or lack of sleep? Okay, and does a change in head position worsen it? Okay. Um, have you noticed that it occurs when you suddenly stand up or turn your head or look up and down? Mm-hmm. Okay, Mr. Hamid, do you feel dizzy when you stand up from a sitting position? Okay, do you ever black out like that? Mm-hmm. Any dark pigmentation on any part of your body? Mm-hmm. All right, Mr. Hamid, do you hear ringing in your ears? Mm-hmm. Okay, and have you noticed any hearing loss? Mm-hmm. I'm very sorry to hear about that, Mr. Hamid. So, can you tell me, do you feel any fullness in your ears? Sometimes. Okay, do you get a headache on one side of your head? Have you had any difficulty working on maintaining balance? Did you get a stick? Uh, mm-hmm. Okay. And have you noticed change in your weight? Mm-hmm. Did you get sick recently? Mm-hmm. Any fever? Any new headaches? Mm-hmm. All right, Mr. Hamid, are you taking any medications on a regular basis? Mm-hmm. Okay. If there is any past history, long-term illness, any previous surgeries, do you have any allergies, Mr. Hamid? Okay. If there is any history of trauma, mm-hmm. Okay. Mm-hmm. Have you had any labs test done recently? Mm-hmm. All right, Mr. Hamid. Is there any history of long-term medical condition in your immediate family members? Mm-hmm. All right, Mr. Hamid, I need to ask you a few personal questions. Is it okay with you? Mm-hmm. Thanks for your cooperation. So, Mr. Hamid, do you smoke, take alcohol, any other drug use? Mm-hmm. What do you do for living? Okay, and how's everything at workplace? How's everything at home? Um, okay, Mr. Hamid, so what is your understanding of your symptoms? All right, and what are you most worried about? Yeah, I totally understand your worries, and I'll try best of my abilities to solve your problem. Is it okay with you, Mr. Hamid? Mm-hmm. Okay, and so Mr. Hamid, you have told me that you have episodic dizziness, nausea, ringing, and fullness in your right ear for almost a month now. Okay, and you probably also have hearing issues, which you are not too sure about. Would you like to add anything else? Mm-hmm. And yes, you stated that it lasts for 10 to 20 minutes. Am I right? Mm-hmm. All right, Mr. Hamid, I would like to perform a physical examination on you. Is that okay with you? Thanks for your cooperation, Mr. Hamid. Could you please move to the couch? And then I'll sanitize my hands and start from general physical examination. I'll check blood pressure when standing, and then I'll check hands if there is any cyanosis, sweating, nicotine stents, pulmonary edema, clubbing, koilankia, and pulse. And then I'll check BP while sitting and then in standing. And then I'll check eyes for conjunctival congestion, corneal reflex, extraocular movements by asking patient look up, and simultaneously I'll check anemia, look down, I'll check jaundice, and show me your tongue, Mr. Hamid. Lift your tongue. Can you swallow? And then I'll check ankles for edema. And Mr. Hamid, could you please unbutton your shirt? I need to listen to your heart. Is that okay with you? And then I'll auscultate aortic, pulmonary, tricuspid, and mitral area. And then I'll ask carotid auscultation for carotid breath. Take deep breath and hold, Mr. Hamid. Okay, Mr. Hamid, and can you walk from here till the door? And can you stand with your feet together and close your eyes? You need not to be worried. I'm here to hold, okay? And keep your head still and follow my finger with your eyes. I'm going to make H in front of you. Thank you. Okay, Mr. Hamid, and can you alternatively clap with your hands like this? First with right and then left. Okay. And then I'll do Rennie and Weber test. Okay, Mr. Hamid, I'll put this fork on your head, okay? And let me know if you can hear vibration from both ears. Okay, and now I'm going to keep it near your right ear. Let me know if you can hear vibration and when it stops. Okay, now I'm going to keep it near your left ear. Okay, Mr. Hamid, I'm going to keep it on your behind your ear. Okay, let me know when vibration stops. Okay, Mr. Hamid, now I'm going to examine you. Okay, could you please come on the couch? Okay, and relax. Okay, and I'll turn your head towards right side. Okay, and then I'll hold it. Okay, and then I'll keep it down the couch. Okay, and I'll hold it for 10 seconds. Is it okay with you? Thanks for your cooperation. And then, so I'll perform Hallpike maneuver, and then on right and then on left side. Thanks for your cooperation, Mr. Hamid. Please button up your shirt. And then again, I'll sanitize my hands. Okay, so Mr. Hamid, from what you have told me, and the history I have, and the questions I have asked and examination I have performed, I come to the conclusion that most probably you are having a condition what we call in a medical terminology is Meniere's disease. Okay, do you know what does it mean? What is Meniere's disease? And do you should I explain it to you? Okay, you need not to be worried, Mr. Hamid. I'm here to explain it to you. Actually, Meniere's disease is a chronic condition that is thought to be related to a buildup of fluid in the ear, and it causes repeated episodes of vertigo as well as hearing loss. ringing in the ear and a feeling of fullness in the ears, and these symptoms often affect one ear. If it makes sense to you, Mr. Hamid? Yes, Mr. Hamid. So for that, I would like you to get an audiometry done so that we can evaluate your hearing loss as well. Is that convenient for you? Yes, Mr. Hamid. I will suggest tablet beta-histine 8 mg. You have to take it 3 times a day. Okay. And tablet Perazine 5 mg. You have to take it 3 times a day, half an hour before meals. Is it okay with you? And along with that, Mr. Hamid, I will advise you to take a low salt diet and avoid tea, coffee, and chocolate. Okay, and take plenty of fluids. Is it okay with you? And Mr. Hamid, I will also suggest wearing a tinnitus master hearing aid to help you with the ringing in your right ear. And my staff nurse will give you details of the device and how it is worn. Okay, and along with that, I'll like to refer you to the ENT consultant for further management. Okay, please see him with results of your odometry test. Is it convenient for you? All right, Mr. Hamid. So I would like to see you again in 2 weeks for a follow-up. Is it okay with you? Yes, Mr. Hamid. If you feel any